We, of course, are also having the ongoing discussion about the latest on the COVID-19 pandemic. And one of the things that we've been talking about consistently, especially over the past couple of weeks, CDC guidelines on quarantining. Those guidelines have changed. Some critics were wanting more changes, including adding a testing component, which the CDC is apparently not doing. Anjalee Khemlani is joining us now. Can you walk us through this controversy, if you will, or this sort of debate back and forth, Anjalee, and what the outcome is?
Absolutely, Julie. And unfortunately, it seems like it is yet unresolved in the eyes of some of those health experts that are still advocating. But where it stands right now is that, as you mentioned, the CDC was getting a lot of pushback after it changed its guidelines to allow individuals to get out of isolation after 5 days and then continue wearing masks for the remaining 5 days. And for anyone in quarantine, also, the 5 days was part of that quarantining to check, especially for asymptomatic individuals. Now, what happened now is that the CDC is responding to that request from public health experts asking for some testing to be involved in basically marking and being able to confirm whether or not someone will test positive or negative coming out of isolation. Now, the CDC didn't require that. They did add that someone could take a test after 5 days, but there is no requirement. And some say that that is part of the ongoing struggle to even get tests, including PCR tests. We know those lines are long. We know at-home tests are not only in shortage, but also prices are increasing for those. So increasingly getting out of access for some people. So that's where things stand right now. The CDC also today is listening to the advisory committee that is meeting to discuss the FDA's authorization of booster doses for Pfizer, specifically for kids ages 12 to 15. We know the FDA authorized that recently, and the CDC has to follow through. The CDC did also adopt the follow-up booster for adults. The FDA had reduced the timeline from 6 months to 5. The CDC has already adopted that, so that does go into effect. But we are waiting to hear on those boosters today. Back to you.
Yeah, and Anj, just any update on the return to work, return to school front? Because I'm noting a story. The Chicago Teachers Union voted yesterday. They're switching to remote learning, and the Chicago Public Schools simply canceled classes today. And we're seeing we're hearing a number of stories across the U.S., including in New York here, about the difficulty with returning to the office and the classroom because of the testing situation.
That's right. So there's actually multiple factors going into the school situation specifically. Right now, across the country, schools are closed in many portions of the country, in part to do with the Omicron surge and the impact on teachers, whether or not they are actually infected or waiting for test results, as well as some areas are also seeing an impact from severe weather that we've seen in the past several days. So the full picture is really just a lot of closed schools, unfortunately, and the reasons vary. But the Omicron variant is actually impacting a lot of things. We talked about right before the new year how because of the surge, there were offices rethinking plans of reopening in the new year, which seemed pretty much okay by fall of last year. But now a lot of rethinking there. We know hospitals are really suffering with individuals unable to get to work because they either have symptoms or may have symptoms or waiting on testing results. So a really mixed picture when it comes to what the situation is across the country, but definitely feeling that impact in a lot of different sectors right now.
My kids are downstairs right now on their computers doing school. Anjalee, thank you so much. Appreciate it.